Typically, your first visit to the clinic will be a visit with me, and we get to talk about your health history and about some of the reasons why you're seeking weight loss surgery, maybe some of the considerations that you've made and contemplating your choice and your procedure of choice. And we'll also develop a plan for you, a plan that will help prepare you for surgery. At that point, we'll also order any additional assessments that you need.
Lifestyle changes are essential to ensure long-term success. Patients need to be ready to meet all of the physical, behavioral, and social challenges of weight loss surgery.
Whether you choose gastric bypass, gastric sleeve, or lap band, our team of skilled surgeons will help you lose the weight necessary to live a healthier life.
It's possible for anybody after any surgery to lose weight and to be successful with that. And sometimes it happens even when they're not making the best choices when it comes to dietary and lifestyle choices. But those are the people that we see back 3 or 4 or 5 years later who put their weight back on. And so it's important to emphasize that change. You really have to see weight loss surgery as an opportunity to achieve success that you've not been able to achieve on your own. But you have to make changes in order for that success to be long-standing.
In order to prepare for weight loss surgery, Journey Clinic patients must be up to date on all screening tests, including colonoscopy, mammogram, and pap smear. Bariatric candidates should quit smoking tobacco and stop all alcohol consumption. Regular exercise is encouraged, and so is attendance at a Norman Regional Support Group.
When you arrive at the hospital on the day of your surgery, usually it's pretty early in the morning, and when you check in, you'll be brought to a preoperative area where you'll have an assessment done by the nursing staff. You'll have lab work that's drawn, you'll have an IV that's inserted, and then you'll get to visit with the surgeon and the anesthesiologist and the nurse from the room that you'll be having your procedure in.
For gastric bypass, expect the procedure to last approximately 1 hour. Most patients will spend 2 nights in the hospital and take at least 2 weeks off from work. For gastric sleeve surgery, expect a procedure time of approximately 40 minutes, with a 1 to 2 night stay in the hospital. Expect to take about a week off work if you have a desk job, longer for those with physical labor jobs. Lap band surgery is performed on an outpatient basis with a procedure time of 30 to 40 minutes. No hospital stay is needed following the procedure, but you should expect to take 3 to 4 days off of work, longer for those with physical labor jobs. With all bariatric procedures, you will be restricted to clear liquids while in the hospital and protein shakes upon discharge. After surgery, you'll recover in a specially equipped private room designed to make your experience as comfortable as possible. Your medical team will make sure you have everything you need for recovery.
At Journey Clinic, post-operative care begins here and continues for as long as you need our help. We believe that patients have the best outcome when they are prepared for the trip home and life after weight loss surgery. Our team is excited about helping you reach your goals.
Our expectation is that once you get to the unit, it's usually about an hour or so after your procedure, that you'll be ready to get up and sit in a chair and maybe start walking, because all of those things will help decrease the amount of time that you have to spend in the hospital, decrease your risk of things such as blood clots and lung infection and that sort of thing. So we really expect you to kind of be up and moving even the day of surgery.
Your post-operative care team includes nurses and physical therapists who are specially trained in the field of bariatrics. Their expertise will help maximize your recovery and prepare you for your trip home.
Most people really want to know how long they have to be off work, and it really depends upon what kind of work that you do. If you have a sedentary job or a desk job, most patients will be able to take 2 weeks off of work and be able to go back. If you have a very physically active job where you're on your feet, where you have physical requirements of you that require you to lift, then you're likely going to have to take about 6 weeks off after surgery.